You ever hear about a medical condition that causes sudden, unbelievable abdominal pain? I mean, pain so bad it feels like it's shooting straight through to your back. Well, one of the top contenders for that in any emergency department is acute pancreatitis. It's a really serious condition that can pop up out of nowhere. So let's break down exactly what it is, what kicks it off, and how doctors fight back. So, what's the common thread here? What on earth connects something like gallstones with a weekend of heavy drinking and that awful radiating pain? Well, the answer is a small but mighty organ tucked away behind the stomach that you probably never think about. That is, until it starts screaming for help. And that brings us right to our first section, the unexpected attack. We're about to see how this hidden little organ, the pancreas, can suddenly flip a switch and become the epicenter of a full-blown medical emergency. So, what is acute pancreatitis? In a nutshell, it's a sudden, angry inflammation of the pancreas. But the way it happens is kind of terrifyingly fascinating. Your pancreas makes these super powerful digestive enzymes. Think of them like a demolition crew, designed to break down food in your gut. But in pancreatitis, that crew gets the wrong address. They activate inside the pancreas itself, and well, they start demolishing their own home. The organ literally starts digesting itself. Okay, so what could possibly trigger such a disaster? Well, it turns out that a whopping 80% of the time, it's one of just two things. You can see it right here. Gallstones are the #1 offender, causing almost half of all cases, and right on its heels is heavy alcohol use. They are, by far, the two main culprits. But, of course, it's not always that simple. While gallstones and alcohol are the big players, they're not the only ones on the field. You can have other triggers, like a tumor blocking things up, sky-high triglyceride levels in your blood, or even some rare side effects from medications. It just goes to show you, it can be a real diagnostic puzzle for doctors. Which leads us perfectly into our next topic, actually solving the diagnosis. Because this thing can look like other problems, clinicians really have to put on their detective hats, piecing together all the clues to figure out what's really going on. And clue number 1, the big one, is the pain. The classic story that makes every doctor's ears perk up is this: a severe, relentless pain in the upper belly that feels like it's boring a hole straight through to the back. And weirdly enough, patients often find that the only thing that gives them even a tiny bit of relief is leaning forward. Once they hear that story, the next move is to check the blood. We're looking for two key enzymes, amylase and lipase. Now, amylase shoots up fast, but it drops off just as quickly. So if someone waits a day or two to go to the hospital, it might look totally normal. That's why lipase is the real star of the show here. It's way more specific to the pancreas, and it stays high for much longer, making it a much more reliable clue. It's absolutely the preferred test. All right, so after the blood work, it's time to get a picture of what's happening. And it's usually a two-step plan. First up is an ultrasound. It's fast, it's easy, and it's fantastic for spotting the most common cause we talked about, gallstones. But if things are still unclear, or if the patient is really, really sick, we bring in the big guns, the CT scan. This gives us a crystal clear look at the pancreas itself, so we can confirm the diagnosis and, more importantly, see just how bad the damage is. Okay, so we've confirmed it's pancreatitis. Now what do? Let's talk about how to treat it. And here's the key. The main strategy isn't about some magic pill. It's about calming that massive inflammatory storm raging inside the body and just giving the pancreas the support it needs to heal itself. And that support rests on 4 main pillars. First, you hit him with tons of IV fluids. This is absolutely critical to fight off dehydration and shock. Second, you have to get that terrible pain under control with strong medications. Third, and this is a big one, you rest the pancreas. That means nothing to eat or drink, period. We call it NPO. You're basically telling the pancreas, hey, you can take a break. You don't need to work right now. And finally, you have to watch them like a hawk. In the hospitals, sometimes even in the ICU if it's a really bad case. Now, what about more hands-on stuff like procedures or surgery? Well, those are only for very specific situations. For example, if a gallstone is physically stuck in a bile duct, causing a blockage, doctors can go in with a scope, a procedure called an ERCP, and pull it out. And in really severe cases, if part of the pancreas dies and gets infected, surgery might be the only way to clean out that dangerous material. But again, these are not the starting moves. So let's fast forward. The patient has made it through the initial crisis, but the journey isn't over. Now we have to talk about recovery, the potential aftermath, and most importantly, how to make sure this never, ever happens again. And we really can't downplay how dangerous this can be in the short term. That massive inflammation can throw the whole body out of whack. It can cause the circulatory system to collapse into shock, the kidneys to fail, the lungs to fill with fluid. We're talking about multi-organ failure. This is exactly why these patients need to be in the hospital. And this is where that CT scan we talked about earlier becomes so incredibly vital. Doctors are looking for something called necrosis, which is a scary word that just means some of the pancreas tissue has actually died. And check out this number. There's a critical tipping point. If that CT scan shows that more than half the pancreas is necrotic, the risk of life-threatening problems and death just goes through the roof. It's a huge red flag. And even after a patient goes home, they're not totally out of the woods. Weeks later, some people can develop something called a pseudocyst. It's basically a pocket of leaked pancreatic fluid that the body walls off. A lot of times they're no big deal, but if they get too big or get infected, they might have to be drained. And all of this brings us to the ultimate goal of long-term care. You have to find and fix the root cause. You just have to. If it was gallstones, the gallbladder probably needs to be removed. If alcohol was the trigger, that has to stop. If triglycerides were off the charts, you have to get them down. Because if you don't fix the underlying problem, another attack isn't a matter of if, it's a matter of when. Which leaves us with a single most important question for anyone who's been through this. Think of acute pancreatitis as a massive fire breaking out in your abdomen. All that emergency treatment, that's just the fire department putting out the flames. The real work, the crucial work, starts the day after, finding out what started that fire in the first place, and doing everything you can to make sure it never, ever gets the chance to spark again.